Everything about infertility in women and female infertility. What is infertility? Infertility means not being able to get pregnant after 1 year of trying, or 6 months if a woman is 35 or older. Women who can get pregnant but are unable to stay pregnant may also be infertile. About 10% of women in the United States, ages 15 to 44, have difficulty getting pregnant or staying pregnant, according to the Centers for Disease Control and Prevention. Pregnancy is the result of a process that has many steps. 1. Ovulation. A woman's body releases an egg from one of her ovaries. 2. Womb. The egg goes through a fallopian tube towards the uterus. 3. Fertilization. A man's sperm fertilizes the egg along the way. 4. Implantation. The fertilized egg attaches to the inside of the uterus. Infertility can happen if there are problems with any of these steps. Is infertility a common problem? Yes. About 10% of women in the United States, ages 15 to 44, have difficulty getting pregnant or staying pregnant, according to the Centers for Disease Control and Prevention. Is infertility just a woman's problem? No. Infertility is not always a woman's problem. Both women and men can have problems that cause infertility. About 1/3 of infertility cases are caused by women's problems. Another third of fertility problems are due to the man. The other cases are caused by a mixture of male and female problems or by unknown problems. What causes infertility in women? Most cases of female infertility are caused by problems with ovulation. Without ovulation, there are no eggs to be fertilized. Some signs that a woman is not ovulating normally include irregular or absent menstrual periods. Ovulation problems are often caused by polycystic ovarian syndrome, also known as PCOS. PCOS is a hormone imbalance problem which can interfere with normal ovulation. PCOS is the most common cause of female infertility. Primary ovarian insufficiency is another cause of ovulation problems. It occurs when a woman's ovaries stop working normally before she is 40, and it is not the same as early menopause. Less common causes of fertility problems in women include blocked fallopian tubes due to a pelvic inflammatory disease, endometriosis, or surgery for an ectopic pregnancy, physical problems with the uterus, uterine fibroids, which are non-cancerous clumps of tissue and muscle on the walls of the uterus. What things increase a woman's risk of infertility? Many things can change a woman's ability to have a baby, including age, smoking, excess alcohol use, stress, poor diet, athletic training, being over or underweight, sexually transmitted infections and health problems that cause hormonal changes like polycystic ovarian syndrome and primary ovarian insufficiency. How does age affect a woman's ability to have children? Many women are waiting until their 30s and 40s to have children. In fact, about 20% of women in the United States now have their first child after age 35. So age is a growing cause of fertility problems. About 1/3 of couples in which the woman is over 35 have fertility problems. Age decreases a woman's chances of having a baby in the following ways. 1. Her ovaries become less able to release eggs. 2. She has a smaller number of eggs left. 3. Her eggs are not as healthy. 4. She is more likely to have health conditions that can cause fertility problems. 5. She is more likely to have a miscarriage. How long should women try to get pregnant before calling their doctors? Most experts suggest at least 1 year. Women 35 or older should see their doctors after 6 months of trying. A woman's chances of having a baby decrease rapidly every year after the age of 30. Some health problems also increase the risk of infertility. Talk to your doctors if you have irregular periods or no menstrual periods, very painful periods, endometriosis, pelvic inflammatory disease, more than one miscarriage. It is a good idea for any woman to talk to a doctor before trying to get pregnant. Doctors can help you get your body ready for a healthy baby. They can also answer questions on fertility and give tips on conceiving. How will doctors find out if a woman and her partner have fertility problems? Doctors will do an infertility checkup. This involves a physical exam. The doctor will also ask for both partners' health and sexual histories. Sometimes this can find the problem. However, most of the time the doctor will need to do more tests. In men, doctors usually begin by testing the semen. They look at the number, shape, and movement of the sperm. Sometimes doctors also suggest testing the level of a man's hormones. In women, the first step is to find out if she is ovulating each month. There are a few ways to do this. A woman can track her own ovulation at home by writing down changes in her morning body temperature for several months, writing down how her cervical mucus looks for several months, using a home ovulation test kit available online or at drug or grocery stores. Doctors can also check ovulation with blood tests, or they can do an ultrasound of the ovaries. If ovulation is normal, there are other fertility tests available. Some common tests of fertility in women include hysterosalpingography. This is an X-ray of the uterus and fallopian tubes. Doctors inject a special dye into the uterus through the vagina. This dye shows up in the X-ray. Doctors can then watch to see if the dye moves freely through the uterus and the fallopian tubes. This can help them find physical blocks that may be causing infertility. Blocks in the system can keep the egg from moving from the fallopian tube to the uterus. A block could also keep the sperm from reaching the egg. Laparoscopy. A minor surgery to see inside the abdomen. The doctor does this with a small tool with a light called a laparoscope. She or he makes a small cut in the lower abdomen and inserts the laparoscope. With the laparoscope, the doctor can check the ovaries, fallopian tubes and uterus for disease and physical problems. Doctors can usually find scarring and endometriosis by laparoscopy. Finding the cause of infertility can be a long and emotional process. It may take time to complete all the needed tests, so don't worry if the problem is not found right away. How do doctors treat infertility? Infertility can be treated with medicine, surgery, artificial insemination, or assisted reproductive technology. Many times these treatments are combined. In most cases, infertility is treated with drugs or surgery. Doctors recommend specific treatments for infertility based on test results, how long the couple has been trying to get pregnant, the age of both the man and woman, the overall health of the partners, preference of the partners. Apart from recommending natural food supplements, doctors often treat infertility in men in the following ways. Sexual problems. Doctors can help men deal with impotence or premature ejaculation. Behavioral therapy and/or medicines can be used in these cases. Too few sperm. Sometimes surgery can correct the cause of the problem. In other cases, doctors surgically remove sperm directly from the male reproductive tract. Antibiotics can also be used to clear up infections affecting sperm count. Sperm movement. Sometimes semen has no sperm because of a block in the man's system. In some cases, surgery can correct the problem. In women, some physical problems can also be corrected with surgery. A number of fertility medicines are used to treat women with ovulation problems. It is important to talk with your doctor about the pros and cons of these medicines. You should understand the possible dangers, benefits, and side effects. Fertility and lifestyle factors. It is well known that certain personal habits and lifestyle factors impact health. Many of these same factors may limit a couple's ability to conceive. Fortunately, however, many of these variables can be regulated to increase not only the chances of conceiving, but also one's overall health. Diet and exercise. Optimal reproductive functioning requires both proper diet and appropriate levels of exercise. Women who are significantly overweight or underweight may have difficulty becoming pregnant. Smoking. Cigarette smoking has been shown to lower sperm counts in men and increase the risk of miscarriage, premature birth and low birth weight babies for women. Smoking by either partner reduces the chance of conceiving with each cycle, either naturally or by IVF, by 1/3. Alcohol. Alcohol intake greatly increases the risk of birth defects for women, and, if in high enough levels in the mother's blood, may cause fetal alcohol syndrome. Alcohol also affects sperm counts in men. Drugs. Drugs such as marijuana and anabolic steroids may impact sperm counts in men. Cocaine use in pregnant women may cause severe retardations and kidney problems in the baby, and is perhaps the worst possible drug to abuse while pregnant. Recreational drug use should be avoided both when trying to conceive and when pregnant. In about 10 to 15% of infertility cases, couples may be told they have what's known as unexplained infertility. In other words, no known physical reason for why they can't conceive. Many of those couples are turning to herbal, vitamin and antioxidant-based food supplements. Although food supplements should not be used as a substitute for a varied diet, they sure can be a good addition. In a large study following over 18,000 women who were trying to get pregnant, researchers found a correlation between taking a multivitamin supplement and having a lower chance of ovulation problems.